these are? Yeah, these are hearts, right? Use one of these right here. It sits like, that didn't help, did it? Oh well, who cares? Anyway, it sits kind of like this direction, right? Kind of off to one side, about the size of your fist. This would be a little big. It's not fit very well. So anyway, the right side pumps blood to the lungs, and that's called the pulmonary circuit. Okay, so the right, remember anatomical position now. So the right side pumps to the lungs, and that's the pulmonary circuit. The left side pumps to all the rest of the body, and that's called the systemic side. So there's pulmonary and systemic sides. And there's 4 chambers. There's 2 receiving chambers, which are called the atria, and 2 pumping chambers, which are called the ventricles. There, that's it, that's the heart. Well, maybe not exactly. The atria are receiving chambers. They don't, they have a little bit of contractive force to them, but really not very much. If you look at this heart that I'm holding up here, we'll open it up like this, and this chamber here and this chamber, top one up over here, are the receiving chambers, the right and left atria. The bigger, muscular, bottom part of the heart are the pumpers, the right ventricle and the left ventricle. And the right ventricle, when it contracts, sends blood to the lungs. The left ventricle, when it contracts, sends blood off to all parts of the body. So an easy way to tell the difference when you're looking, say, at a sheep heart between the right and the left ventricles is the left ventricle always has a much more muscular wall to it, because it's got to contract with more force, because it's, I mean, what? The heart's here. Where are the lungs? Well, they're right here. So the right side doesn't have to pump very far, just right here. The left side, it's got to go everywhere, right? So the left side, the chamber is more muscular in structure. All right, so that's the pump. It started before you were born, and it will pump your entire life until it quits, which hopefully will be a long time from that. Oops. Sorry. Anyway, this is just a picture of your book. No big deal. Just shows you where all the stuff gets taken. The systemic side and the pulmonary side. We'll get to this in more detail. Anyway. Oh. Yeah, that's the good one. The bottom pointy part of the heart is the apex. So this one, like I said, angles towards the left lungs. This is the apex. The base of the heart, I don't know, maybe somewhere right here, kind of, because here's the aorta. I don't know. We're probably pointing to somewhere right around here. It's not a distinct structure. Sits in the pericardial cavity, angled a little bit to the left. This big notch here is called the cardiac notch, and we get the respiratory system next week. That's the reason that the right lung has 3 lobes, the lung got 2. Anyway, that's where it's located. No, here we go. Back to this. Anyway, no, so it's in a cavity. You know where it is. We talked about these cavities a few weeks ago. Pericardial cavity, which is the mediastinum. But here goes these membranes again. Visceral and parietal. Right, there's a membrane when you open your cats up, you'll see it. Well, no, you won't see it. What you'll see is in the thoracic cavity, you'll see a sac. You won't see the heart, you'll just see a sac. And the sac is the pericardial sac. And the outside of that pericardial sac, what you're kind of looking at, well, a little bit of fat, what you're looking at is the sac, and it has 2 membranes. When you open up the sac, you'll see that there's a membrane on the surface of the heart. And that always goes by the name visceral. So the visceral pericardium is the membrane, the inside of the lining of the pericardial sac that lays on the surface of the heart. The outer membrane of the sac is the parietal pericardium. So kind of when you're looking right at the heart, before you actually open the sac up, you're looking at the parietal pericardium, the outer fibrous layer. Now, the reason it's in a sac is because, well, look, if it wasn't in some sort of protective sac, what's gonna happen? Well, it'd just be beaten here in this cavity, it'd be rubbing against the lungs and, I don't know, everything else, right? So it's inside this protective sac, right, that keeps it isolated from, you know, the surrounding structures. It also, you know, keeps the heart, you know, moisture in there and keeps everything lubricated. Anyway, so you got these two layers. The one on the surface is the visceral, the one on the outside is the pericardium. And you might as well use this because this visceral pericardium is going to be with us for the next 2 weeks. Can't get rid of them. Right? So when you open up your cats, so the sheep hearts, no, they're not in a sac, right? There's no membranes there anymore. They used to be, but not anymore. If you open up these heart surgeries, you know, when you see heart surgery on television, you know, and they're gonna, I don't know whatever, and the heart's like beating in the chest. Well, they've already cut open the sac. That's already been reflected back, you know, and you're seeing the heartbeat. You're not seeing the membranes. They've already been removed. All right, so here's a picture. I don't know, I guess this is a good one to look at. So there's 3 layers. Here they come again, just like layers around the muscle and layers around nerves. Anatomy's full of layers. Okay, so endo, myo, and epi, cardium. So obviously cardium part. All right. So the heart's a muscle, and we'll start in the middle. And this middle muscular layer, the muscle of the heart, is called the myocardium. Right, so when you here, okay, so you open up a sheep heart, whatever, and you see all this muscle in here, right? The muscle is the myocardium. That's just what it's called, right? So it's the myocardium. The inside of the heart has a thin connective tissue lining in it. You can see it in the sheep heart pretty well. It's kind of white, shiny looking. Well, not really white, but it's shiny looking. And this inner lining of the heart is called the endocardium. So endo, just like the endomysium. Right? So the endo's in the inside. The muscle's the myo. And then there's only one left. Epi means upon. So the outer layer is the epicardium, which is the same as the visceral pericardium. So, I should have put my gloves away, but maybe I've got a pair of, you know what, let me just get another glove. Let me just show you how this works on the heart. That way I will have done something that I don't need to do later. All right, so I'm going to show you how this works.